when I first started, I read my own exams, but by the time I finished, I think the last year or two, I had to have people actually read my exams to me, which was a big change in just getting used to how you do exams.
Daniel Morris, research assistant, dietitian, massage therapist.
I was the first student to go through my program with a vision impairment or who was legally blind.
Daniel talks about his challenges that he faced at university during his master's degree.
I made sure I knew what the assessments were before I went and the objectives of the course, so I could identify areas that may not be accessible, and then I made sure that I had solutions. I wasn't just going there as a problem.
Daniel brings to light the importance of developing a relationship with your professors and the Office of Students with Disabilities.
People to look upon someone that is visually impaired or blind in a positive way.
Canada and the US may be a border apart, but we have a lot of common ground. In a few words like stage, practical, clinical, as is university to college. And with accessibility in mind, we are more alike than different.
These people have an enormous capability of adapting to a changing world. They can work in teams, and they're the main qualities that employers want.
For more podcasts with a blindness perspective, check us out on the web at www.blindabilities.com, on Twitter @blindabilities, and download the free Blind Abilities app from the App Store and on Google Play. That's 2 words, Blind Abilities. You can also enable the Blind Abilities skill on your Amazon device. Just say, enable Blind Abilities.
Strive for the best possible lifestyle. Don't sell yourself short. Don't settle for anything less than the best.
And now, here's Nick D'Ambrosio in the studios with Daniel Morris. We hope you enjoy.
Welcome to Blind Abilities. My name is Nick D'Ambrosio. With me today is Daniel Morris, a research assistant, dietitian, and a massage therapist. Daniel, thank you for joining me.
Thanks, Nick. It's an absolute pleasure to be on the show.
As you can tell, Daniel has a slight accent and comes from Sydney, Australia. So Daniel, what brought you here to Montreal, Canada?
Well, Nick, like most Australians, love brought me to Canada. My wife, she's French-Canadian, and we decided to settle in Montreal. Before I moved to Canada, in Australia, my original degree was in biological sciences or environmental science, and I worked for the Australian government. I worked for the Department of Agriculture, Forestry and Fisheries, and to best explain my role, it was somewhere between what you have as an agricultural officer in Canada or the United States. It was similar to a customs officer. So we used to receive all the documentation and inspect passengers at the airport or the mail or cargo coming through, and everything that was organic, we used to have to check that it had no pests and diseases and it was okay for the Australian environment and it was at no risk to Australian industries. So when I moved to Montreal, I resigned and then started my role on trying to establish a new career for myself in Montreal.
Once you got here to Montreal, what were the steps that you took to get some assistance since you were in a new city, a new country, and a new university?
The first step that I took was to associate myself with the Montreal Association for the Blind. When I first arrived, I didn't use a cane. I was legally blind, but I was one of those people with retinitis pigmentosa that left it to the last minute to start developing my mobility. And so I got the usual help in magnifiers and assistance with computer and things like that. And I worked originally as a massage therapist when I arrived. I never worked at that career in Australia. I did my training in Australia. I took it in the evening when I worked for the federal government, mainly as a planning step for the future. I realized that my vision loss would increase and that I'll be at a point where I might need a new career or an additional career or a sideline just to continue on working. And so when I arrived here in Canada, I arrived on a working holiday visa for the first 2 years. My opportunities to work were limited, but I could work as a massage therapist. So that's the profession that I chose. After that, I really started to think, okay, what do I want to do as a future career? I worked in the federal government, and when I quit my job and came here, it's not as if you can just switch to the Canadian public service. So I really had to think about, do I join the public service? Do I go back and retrain? And I really had a passion of nutrition, but I also liked counseling and I liked a few other professions. So I really had to think, what do I actually like to do, and what is an occupation that will lead to meaningful opportunities, and an occupation that I could do when I have decreased vision and when I'm totally blind. So I came to the conclusion to go back to McGill University with the learning some new skills through the Montreal Association for the Blind. For example, I took a course in touch typing. Before I went back to university, I got more acquainted with handheld magnifiers, electric magnifiers that I might need, and even started lessons in JAWS if I was going to use a PC. I ended up actually being a Mac user, so I then had to learn JAWS not long after that. But when I first enrolled in university, and I enrolled in a master's in nutrition and a diploma in dietetics, but I didn't have all the qualifying subjects. My original degree was biology, and I didn't do nutrition. So I had to do a year of undergraduate subjects full-time to do all the prerequisites in nutrition. Then I got entry into the master's program, which was a 2-year program full-time. And then the dietetics, which is a STARS or a residency, whatever, depending on what you want to call it. And that's a 40 weeks of actual on-the-job practical, where you then become a registered dietitian at the end of that.
Did you find any hardships in your journey to get your degree, specifically with teachers, locations, or even other students?
That's a very good question, Nick. Everything was new to me. I hadn't been in Canada for very long, a couple of years. I knew Montreal, but the university I was going to was McGill University, and they had a campus downtown, and they had a campus about 45 minutes, an hour bus ride away. So I had to become acquainted with new locations. I was going under significant vision loss at the time. So when I started university, I think from memory, I could read 18 bolded font on a page, but very slowly. And I could read on my computer with the color contrast inverted, but again, very slowly. And when I entered university, I realized the volume of material is enormous, that you have to read and prepare. Straight away, I realized I needed assistance. Like most people with a physical disability, I was off to the office for students with a disability, and I met with a coordinator, and they asked me what my needs were, my level of vision, and they said what options were available. And part of that was that we're lucky here in Quebec in that they do have some funding. And one of the first things I got was a program called Kurzweil 3000, which helped me read the numerous amounts of PDFs, whether they were textbooks or scientific articles in PDF. I then improved my skills on how to use VoiceOver on the Mac. And I also got a few additional tools over time. I got the handheld CCTV, which is quite small. It's probably a little bit bigger than an iPhone, which was a lifesaver in reading charts, especially during my stage, and also for writing. I could hold it there and write and see what I was actually writing and make sure I was writing things in the right location. There were some of the tools that I had as my vision decreased. I also had a note taker. I also had people to read me my exams. When I first started, I read my own exams, but by the time I finished, I think the last year or two, I had to have people actually read my exams to me, which was a big change in just getting used to how you do exams. When you're doing time and a half or double time in an exam, going through an exam for 6 hours and having someone read you 200 multiple choice questions, which may involve or may not involve calculations, is a big change from being able to actually do it yourself. And you don't really have time for adjustment. You know, you have to pass these major subjects and continue on to make it to the next year or the next semester in your course. Some of the challenges that I faced in interacting with people was each professor is different, and you have to get to know each professor. I was very fortunate. I had a wonderful supervisor for all those 4 years. Even during my time where I did a year of undergraduate studies, I had a postgraduate supervisor, and we'd check in at least once or twice a semester. And part of that, she was making sure that everything was accessible and that I wasn't having any problems or there wasn't any barriers that I couldn't overcome. And I'd also work closely with the Office for the Students with a Disability, and they would help if I had any problems, but they were far and few between. On most occasions, I had a really good experience with the professors. I think part of that experience was getting to know each professor individually and really assessing where they're coming from. You know, in the back of their mind that I was the first student to go through my program with a vision impairment or who was legally blind. They had one other student, which wasn't a good experience. So I was coming through probably a year or two after that, but they never had somebody from start to finish that had a condition such as retinitis pigmentosa, where they had to adapt a little bit. And they didn't really have an understanding of that it was degenerative. They just had an understanding of, okay, what am I capable of doing? What assistance do I need right here and right now in each course that I went through? So in my terms, I really had to work out each professor individually. I had to make how flexible they were, what the objectives were of their course, what they expected students to achieve, and how they expected students to be examined, and then how to make that accessible for me. And for the most part, I had very good experience. A lot of the professors, they had fantastic ideas. They came up with ideas that I didn't even think of myself. And we worked together to make all sorts of environments accessible, from the lab exams to working in groups. Presentations were never a problem. But then also the different exams. Like some of my exams were very long, involved in a lot of calculations and handwritten material. Some involved pictures, and some involved doing charts or drawing graphs and tables. So they weren't kind of the standard, multiple choice exam or short answer questions. So sometimes we really had to think outside the box, but we worked together, and that was what I did at the beginning of the semester. I worked out who my professors were, where their offices were located, and that may sound silly, but going between two campuses and finding offices in various locations and the office times that they were available, and to make sure that you're there during those times and make an appointment. I made sure I knew what the assessments were before I went and the objectives of the course, so I could identify areas that may not be accessible. And then I made sure that I had solutions. I wasn't just going there as a problem. I was going there with solutions on how to make this work. With that in mind, and then from their perspective, which was usually positive, we would come up with answers rather quickly, and that would be communicated if it had to involve the Office for Students with a Disability. If I was sitting the exam there, we would communicate back with them. Otherwise, we'd just come up with an assessment-based activity, and that would be done at university.
You put the onus on yourself to try to be the best student in the class, not only for yourself, but also for a selfish reason, to maybe kind of let the teacher know that if you can't give me the necessary equipment or the necessary tools to succeed, then who can you give it to?
Absolutely, Nick. I believe wholeheartedly in the social model. So looking at changing the environment. One of the things that I really tried to achieve was not just finishing the degree, but accomplishing each semester at a very high standard. I set myself a goal of passing with an A grade, and I achieved that. My lowest grade was an A minus. And my thought process was, if for whatever reason this can't be accessible for me, if you can't make your course accessible for one of your very top students with one of the top grade point averages, then technically no one else should actually continue and become a dietitian. If your best are not allowed to succeed, well, then technically no one should be allowed to succeed.
You did one better. On your last year, your graduating year, you went and see a psychologist. Why did you do that?
I realized that during the last year, which was the stage, which was 40 weeks of on-the-job training, and we did 3 different stages in 3 different areas. Community stage, which was usually at a non-profit organization or a government organization. The second was clinical, which was done throughout different departments or different wards or units within a hospital. And the third one was food safety or food service industry. So it was in a big kitchen. And we had to complete 40 weeks of that, but 20 weeks of that was in a clinical environment. And I worked at one particular hospital. That was a huge hospital, very old. It was like a rabbit warren. And I was working in all different departments. And I saw my schedule that came out, and I was working in the ICU, so the intensive care unit, for 4 weeks. I was working in the outpatient nephrology, which means patients on dialysis. I was working in the bariatric unit, both pre and post surgery. And I was also working in geriatrics. So I had a number of different environments. I had a lot of different people I had to interact with. Imagine working in intensive care unit. You have a few physicians, you have fellows, you have residents, you have medical students, you have nurses, you have admin assistants, you have orderlies. You have nurses' assistants, and then you have people that come around to do the x-rays. You have physiotherapists, you have social workers, and probably a number of other people that I've forgotten about. So the interaction over that 4 weeks is enormous with all different people. And not just that, the patients are incredibly sick, and you have to know your environment. So that was my motivation for going to see a psychologist, how to interact with all these people, how to get over that fear of going into a new environment, how to prepare for that new environment, and how to just, as well, on top of that, just deal with the fact that my vision was decreasing semester to semester, and that I had to adapt myself with my own technology to be able to read. There was handwritten charts, there was electronic charts, and so I had a number of different techniques for when I went in. And but the psychologist really helped me, especially to prepare and to get over that anxiety. And when I faced a barrier, we worked through it together. So I saw a psychologist, I can't remember now, but it must have been 12 to 16 weeks once a week. It started a couple of months before my stage, just to kind of initially start to go through some of the issues of vision loss, and then work around, how can I start preparing for my first set of stage in the hospital. And it was an excellent experience. I find with the blind community that I interacted with in Montreal, sometimes talking about these things is a little bit often seen as a sign of weakness, or that you didn't do it by yourself. But you know they're successful. Blind people, like any successful people in life, they have a lot of support. They have a team around them, whether it's family, whether it's friends, whether they pay for support, or whether it's certain kind of social workers, or whether it's a psychologist, or whether it's a life coach, or whatever it is, that successful people have that support around them. It was one of the best moves that I made during my university, and it certainly helped me get through the clinical stage and to have a positive experience, and for people to look upon someone that is visually impaired or blind in a positive way, in the way that it helped me interact with them, or get my environment to change, but also to be prepared for that environment when I went in.
Well, it definitely wasn't a sense of weakness on your behalf to take a psychology. I think it was actually very proactive, and you had a lot on your plate, and that's what people don't understand sometimes. There's a lot going on, and especially in the field that you were in, dealing with hospital and dealing with location and your eyesight loss. So I tip my cap to you for actually going the extra yard and doing that and succeeding. Now, once you were going through the whole process, Daniel, how did you overcome some of the challenges in your stage?
Well, as we mentioned, the psychologist gave me some great ideas, and we worked together to come up with solutions. I'll give you a few examples of the preparation that I did. And this preparation helped me get over the anxiety of working in a new environment. For instance, when I started in the intensive care unit, I went to meet the dietitian about 2 weeks before. I met with her, I sat down, I introduced her, I talked about what she expected of me. During those 4 weeks, I asked her for all the reading that was required. So she was very helpful, and she was very appreciative that I came to her so early to prepare. She sent me all the reading by email. I had, enormous amounts of scientific articles to go through. I made sure I read them multiple times, so I was totally up to date in the care that was required by a dietitian in the intensive care unit. She introduced me to some of the staff who were permanent in the intensive care unit, like the admin staff, the head nurse, the assistant head nurses. She introduced me to the head of the ICU, the physician, and she introduced me to some of the physicians who were there, who I might meet within my 4 weeks. Because they rotate every 2 weeks. And so I went in and I knew most of the people that I needed to know. I gave the head nurse, the physicians, the permission to talk about my vision loss and my condition. I explained to them about retinitis pigmentosa, and I gave them permission to talk to the residents, the medical students, to make them aware of who I was and the permissions that I had. For instance, I had permission to take a photo of the chart, and then I had to delete it before I left during the day. I knew where everything was in the intensive care unit. I knew where to wash my hands. I knew where the gowns were that I had to put on when I went into a room where it was quarantined, that you had to wear a gown and a mask and gloves before you went in to view a patient. So I was totally prepared. I knew how to get to the intensive care unit. Now, this might sound silly to some listeners, but the hospital was like a rabbit warren. So I had to learn how to get from my coordinator's office to the intensive care unit, to go to the dietitian's office, to get to where the level where the kitchen was, where they prepared the supplements, how to find the closest exits, how to use the lifts nearby, where were the closest toilets. So I need to practice how to get to all these places. So I went in some of the afternoons and the evenings after I finished my other stage, and I just walked around. I got lost. I found new flights of stairs that I never knew about. I found new pavilions that I never knew about, but I eventually found my way, and I can get around quite quickly. I almost look like a sighted person getting around, and people appreciated all that preparation.
The effort you took in.
Absolutely. And that leads me into the biggest positive move that I made. When I was a stage student, I was enthusiastic. I was overly keen. I was so keen to learn, to soak up all the information. I was so interested in intensive care unit for that 4 weeks. Not that I ever wanted to work in intensive care or in the other areas that I worked in a clinical. That wasn't my interest, but I had a genuine interest in learning, but I made sure that I was keen and I was enthusiastic and I had a smile on my face. I was thankful. I was pleasant. I was easy to do with. I was able to take criticism from a doctor or a pharmacist or a medical student who might have been a bit rude or who might have had not the time of day or who may not have thought very much of my suggestion. I was able to take that on the shoulder and move on. And I made sure that, I took all the constructive feedback from my dietitian and I applied it. So I was enthusiastic in every way. And I think that is what made the biggest difference with the preparation. And that would be my main advice for anyone going through any kind of professional degree or stage where they have to interact with on-the-job training, is that people really appreciate you being prepared and you being enthusiastic.
And I think also passionate about what you're doing and also put a great effort. And I think you did all of those things.
Absolutely. I mean, it's an incredible amount of hard work. So, when you're looking at qualities that make you get through this degree and succeed at a high level, you can identify 3 real qualities in my personal experience. And that was hard work, perseverance, and enthusiasm. And they were the 3 main factors that I think got me through the 4 years. They weren't easy by any means. Was I happy that they were over? Absolutely. Yeah. I was cheering at the end of those 4 years.
I can't imagine after all of that. I'm exhausted already listening to all of this. But it must have been great.
I remember when I finished, I wasn't cheering actually. It was almost like a sigh of relief. You could relax for the first time. You were spending 10, 12 hours a day, either face to face on the job and then working in the afternoons, evenings, and that was through the weekend. And I did it full time, and I kind of rode the wave, I guess, of university study, doing it full time with everyone else, and you just keep going, and you have to keep going with a smile on your face. Some of it is exciting and you're really interested in it, and some of it, well, you just got to do it to move on to the next step. You got to pass it and keep going. It is hard work and you need to persevere, but you need to do it with a smile on your face and be enthusiastic.
Now, I know you gave us some advice already, but is there a motto or something else that you can give the listeners some advice on the whole journey, just to wrap this all up?
I gave you a number of qualities, but another phrase, catchphrase, if you like, that comes to mind is that courage is contagious. You got to have courage to enroll. You got to have courage to walk out your front door. You got to have courage to turn up at your stage. You got to have courage to sit that exam for 6 hours that you can't see and someone reads to you. But once you start, you realize that you're on that journey. You're almost riding a wave along with everybody else. And that brings more and more courage within yourself. And the experience of that will help, develop courage in other people to do the same thing. And part of this whole process is that being the first person to go through McGill University and become a qualified dietitian who was legally blind, I see myself, I guess, as a leader for other people, not just to go through in dietetics, but for other professions that have not yet had someone who was vision impaired. Sure, there's been vision impaired lawyers, there's been vision impaired social workers, but maybe there's some other professions where they haven't had representation yet they are a profession, that is quite accessible, and where people can do the degree and then go off and have meaningful employment and inspire other people to do the same.
Well, that leads me to an easy segue. You and your wife have made a scholarship for people with visual impairment. Can you tell us a little bit about that?
It's one of the proudest things that my wife and I have done. We're fortunate in that we can give back and try and help other people have the same experience that we have. My wife went to McGill University as a postgraduate student as well. She had a tremendous experience both studying at McGill and then working there as a staff. She is now an associate professor. And we decided to give back and to try and encourage other people to become leaders in their field, whether that was from the blind community or people with other physical disability. So the scholarship that we set up, it had a number of requirements. You had to be at McGill University for at least 6 months. You had to be doing an undergraduate degree, and that degree had to be a professional degree. You could look at professional degree as being a social worker, a musician, you could be a teacher, you can be an engineer, you can be a software programmer, anything you like that leads to actually having a profession. And it was based on academic performance. It firstly goes to people that are registered with the Office for Students with Disability who are legally blind. And if there are no candidates, well, then it goes to someone with another type of physical disability. It's the first year of it being up and running, and it went to 2 students who were legally blind, one in the last year of law, and another one doing a research honors year in biochemistry. And they wrote a letter each to my wife and I, and we were really happy at the choice where the students with disability, they chose these students. They were amazing achievements, not just at university, but they were also advocates in trying to bring about change for people with disability, whether that was a university level or outside the university. We were really proud that it went to people that we thought, or who we were trying to help. We were trying to create new leaders for the blind community, people that have done professional degree that then go out there and try and instill a positive impression of the blind community and also bring about change in the environment, but also act as leaders in that other people, whether it's in the corporate world or whether the government or non-profit world, will see that it's an advantage to your organization to hire people that are blind, but also who are incredibly talented, incredibly hardworking. For me, these people that are graduating with very good degrees at a high level, it says to me those 3 qualities that we mentioned earlier, that these people are incredibly hardworking, that they're perseverant, that they're enthusiastic, and they have endless amounts of courage to get out there and succeed. And if you're an employer, what else could you want? Going along with that is that these people have an enormous capability of adapting to a changing world. They can work in teams, and they're the main qualities that employers want. And so demonstrating that to employers and demonstrating to that at people at university, whether it's professors or the people that they interact with. And our hope is that over the years, we will develop more and more leaders in different professions, and they would be a fine example wherever they may come to Montreal, but they may move to other provinces. And if other people end up doing something similar, or we encourage people to really support the blind community or people with a physical disability to provide the same opportunities, then hopefully we can provide leaders all across the board, and they can go out and be heroes for the blind community in breaking some of the barriers and opening doors to reduce the rates of unemployment, both in the United States and Canada.
Including being a pioneer in their field.
Absolutely.
I'd be remiss, Daniel, if I didn't mention that you were, of course, a dietitian and that there is an obesity problem in the US and Canada. And having to deal with blindness is one thing, having to worry about what we need to eat and exercise, it is overwhelming for a lot of people, especially in the blind community. Do you have any advice on how to eat and what to do for someone who might be struggling with weight and weight loss?
It's a difficult question, Nick, and a rather loaded question, and for the time that we have. My advice to people would be strive for the best possible lifestyle. Don't sell yourself short. Don't settle for anything less than the best. And by that, I mean look for the best examples of people that have the longest life expectancy and the longest healthy life expectancy. So they live long, but they live well, and they don't have high rates of chronic disease such as cardiovascular disease, diabetes, various types of cancer. And so they really live long, well, and happy lives. And that's the goal of most people. We don't want to be average. We don't want to settle for that. And there's no reason because someone has a physical disability that they should settle for anything less than the best for themselves, their family, and even the community that they're part of. I encourage people to look towards the healthiest populations. And there are a number of them around the world that we can look for as the example. There's lots of literature on them, and that's part of nutrition and wellness in that there's so much information out there. What do you actually listen to? And I would look for information on the healthiest populations. So some of those might be, some of those populations in the Mediterranean, such as parts of Italy and Greece after the Second World War. You can look to Japan and the island of Okinawa in Japan. And after the Second World War, they had the most centurions, some of the lowest rates of chronic disease, the longest life expectancy. And if you look for a modern day equivalent, there's a modern day equivalent in the USA. And in the United States, they have probably the current longest living population in the Western world or globally, and that's the Seventh-day Adventists. And so they follow a lot of the factors that have been associated with a long life. And just to mention them very briefly, they are moving towards a plant-based diet, if not totally plant-based. By plant-based, I mean vegan, or almost vegan. So
this is the common thread amongst all of these groups that you were talking about, the most part?
For the most part, they're the common threads identified. And part of that is diet, a plant-based diet, or as close as possible to a plant-based diet. Non-nutrition factors involve exercise. They involve stress management, living a low-stress life, and also being part of a caring or loving community. That was a big factor that's being identified. Scientists thought that was in the past a little bit wishy-washy, a little bit fairy, not quantitative, not enough, hard science and data behind that. But that's one of the factors they're identifying. Another factor that came out, which is related to that, is one of the biggest correlations with dying early is living alone. So it may sound very small, but being part of a caring, loving community is a big factor in reducing incidence of chronic disease and living a longer, healthier life. But trying to combine all those factors would be my advice to people. Look for those populations that are the longest, healthiest living populations. Don't look towards fads. Don't look towards information selling a product, but look towards examples. Now, these people, they don't go reading the scientific literature, but the scientists go to them looking for their secrets and trying to validate them through rigorous scientific method. But these people have been successful for generations, sometimes hundreds of years, living in this way. And they're not the wealthy communities throughout the world. I mean, Seven-day Adventists are more of a modern day, and they're more modern society. But some of these others are what they call the blue zone. So they're actually poorer areas, but poorer areas that are being forced to do these things that are extremely healthy and lead to a long and healthy life.
Well, we'll put a few of these links in the show notes for our viewers to take and listen to. But we urge everyone to go on their own and do a little research and find out, like Daniel said, a plant diet. And I would assume that would be probably about 90%.
If I had to summarize across all these countries, I would estimate that it would be between 90 to 100% plant-based diet. Now I'm talking calories during the day. And we don't want to go and count calories. That can be very time-consuming. I guess there's apps that can do that if you've got the time, put it in. But thinking about that, the vast majority, 90% or more, was from foods derived from a plant-based origin. And to some people, that could be a very big change. But keep in mind that every change towards all those factors that I mentioned, not just the diet-related factors, all those factors lead to small positive changes in health. So it's a slow stepping stone of slow improvement leading to a small benefit, and that benefiting increasing over time.
Now, I know you have clients being a dietitian, and I guess it's a one-on-one. Every case is very different and very individualistic, and depending on the types of people you get with the types of diseases they might have, how do you tackle each one individually? And is it always straightforward a diet, or is there other factors that you take in consideration?
Well, I have to stick to what I'm trained in professionally. So, I can incorporate diet and exercise and make suggestions for the other factors. But each person is an individual, and you have to treat them that way. Each person has different goals that they want. You have to work with that, but you have to work together. If their goals are not, I guess, more realistic, or you think that they may not know what is actually possible, my role is to inform them of the science and then work together to develop goals and then steps of working towards those goals. What I like to make clear to my clients is the possibilities, and then they decide what works for them. So I make sure that they know the best possible scientific literature and what is actually possible through diet and lifestyle. And if they choose, okay, I want to work slowly towards getting there, or I may not want to go all the way towards, the gold standard, of the longest living, healthiest populations, that's their right and their decision. And you have to respect that. You have to help them get to where they're prepared to go. And so you got to tackle each client as an individual. You can't tackle them as a prevention population-based scenario. And I guess that's the benefit of a personalized dietitian. And when you consult them, part of their role is that they're helping you really get to your goals, but also make you aware of exactly what is possible. The old expression that you're really holding their hand while you're walking them down the path towards the end goal and just making sure they stay on that path. But there is multiple paths along the way that they're going to choose, and those paths may actually change, and the end point may exactly change. They may think, whoa, I thought this was only possible, but now I realize that, I'm going to strive for one step higher. Or, you take it in small steps and see how they go. But when people start on that journey and they feel the benefits of what starts to happen, that's the real incentive to keep going. So again, going back, it's similar advice to when I was in my stage. Part of the hardest thing is actually to start. And when you get the skills to walk down that path and you start to feel the benefits, then you realize, whoa, this is the path that I really want to take. And I even want to, take it a level or two up to really even continue these benefits.
You've seen people with chronic diseases almost take a 180 and change their lives with just diet in some cases.
Absolutely. The possibilities from the scientific literature are amazing. People with pre-diabetes or on medication, working closely with their physician and either reduce or stop their medication. People with cardiovascular disease, with their cholesterol levels, falling dramatic, significant decreases in total cholesterol, LCL cholesterol, which really have positive effects not just on the cardiovascular disease, but eating that particular type of plant-based diet will then have other benefits on their overall health. You read about these benefits in the scientific literature, but then when they start to happen with the clients that you see, you have to pinch yourself sometimes. You're like, it really is possible. I read about it, but I never imagined that I'd be doing it. And then if I imagined I'd be doing it, I'd never imagined that this would be the result. When a client comes in and says, Daniel, this is the waistline that I had when I was, when I was 20 years of age, and this person's in their 60s and 70s. I had to go, thanks very much. Your consultant fee wasn't very much, but I had to go and buy myself a whole new wardrobe. But, they're getting back their health, and the side effect from good health is weight loss. I try and make the focus on good health, and then one of those side effects is going towards a normal body weight. The focus, from my point of view, is never on the weight loss or looking good. The focus is on good health leading to a long, healthy life, and then the side effect is weight loss.
Well, Daniel, this has been a fascinating conversation. I really thank you for taking the time to be on Blind Abilities, and hopefully one day we'll have you back once again. Maybe these students that you have in your scholarship program graduate, so hopefully we'll have you on once again in the near future. And thank you very much once again.
Thanks, Nick. It's been a pleasure.
Such a great story how Daniel Morris took on the challenges at university. And be sure to check out the show notes for some of the links that Daniel Morris provided and some of the topics that he referenced. And as always, a great job by Nick D'Ambrosio in the studios at Blind Abilities. And a big thank you goes out to Chichow for his beautiful music. And you can reach Chichow on Twitter at LChichow. Once again, thank you for listening. We hope you enjoyed. And until next time, bye-bye.
When we share
what we see
through each other's eyes, we can then begin to bridge the gap between
the limited expectations and the realities of blind abilities.
The realities of blind abilities.
For more podcasts with a blindness perspective, check us out on the web at www.blindabilities.com, on Twitter at blindabilities. Download our app from the App Store, Blind Abilities, that's 2 words, or send us an email at info@blindabilities.com. Thanks for listening.